Hello and welcome to another edition of Professor Speaks. Today we're going to be talking about what to do if you don't have health insurance. But before we do that, I'd like to remind you to hit subscribe and hit the little bell for notifications. Hello and welcome. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And jumping right into it, we're talking about what to do if you don't have health insurance. So some of you out there might not have health insurance. Maybe you lost your job, or for whatever reason you just can't afford health insurance at the time, and there are options available for you out there. We want to talk about some of them today. What are some of these options that people out there have?
Yeah, this is an important topic in that people that don't have healthcare insurance have to start looking for cheaper products. Clearly part of the issue with regard to the Affordable Care Act as an alternative has been find cheaper products. So products such as Oscar and others, we're not promoting any one. We're trying to identify, to look around and see if there is. The pro and con argument of this is that there are some that are cheaper and some that are very cheap.
Right.
But you have to look at coverage. So you may not spend much money, but it may not cover much.
Okay.
So the argument that you can find something that's cheaper and you can deal with it so that it'll cover your needs, you need to be very careful to make sure it covers your needs. So number one is, does it cover whatever the healthcare conditions are for you and your family members?
Okay.
Two, does it cover the drugs that you are currently getting for yourself and your family members?
Right.
So that if so, you're getting something that would cover it. If not, we'll talk about other options.
Right. Well, you also mentioned the ACA. I want to go back to what you had said. You mentioned the ACA, and there's a lot of talk about the ACA, otherwise known as Obamacare, about Congress wanting to break it up. What kind of effect would that have on the people, in the lamest of terms, of course, because there's a huge complex. I'm sure.
Well, trying to keep politics out of it. The issue here is the Affordable Care Act gives everyone health care insurance, but requires that people who don't have a great need for it still pay in. Those who do have a need for it also pay in. And the law of large numbers works as it does in all healthcare insurance, where everybody pays in and a few people take money out. That is the necessity of the law of large numbers, to ensure that there's money for everyone. However, there is clearly a move in Congress to break up the Affordable Care Act, so that the argument being that, well, people will be able to go out there, there'll be access to different plans, and they'll be able to buy it cheaper than what they have to do under the Affordable Care Act.
Okay.
The main rub there is that in the Affordable Care Act, they've included essential health care benefits to ensure the fact that people are being evaluated for fundamental problems.
But there's like testing?
Testing, but there's also yearly physicals. So that's a preventive mechanism. Issues with regard to free types of things like the annual visit, immunizations, things like that, with a major emphasis on prevention.
So it's quality assurance.
It's quality assurance. Yeah. So if you break it up, then you have to go find a plan that has either an alternative to the essential healthcare benefits, or more importantly, which benefits do you and your family care about, and find it in something that's affordable. That makes it harder. The argument is there'll be greater access, and wherever you stand on that issue, will be trying to find something that's affordable but still covers the problems that you and your family have and the drugs that treat those conditions.
Or that it's affordable, and that these insurance companies also help with the quality assurance that we talked about, the preventative measures.
Yes.
Yeah, that's stuff. And also we want to take a quick little side note and just make sure that we cover our bases here, because it is Nurses Week, and we want to show that we love the nurses, right? We just absolutely love the nurses.
Well, some of us, including me, are married to a nurse, so I think that's a really important thing. But realize that there are alternatives to having healthcare insurance. So, for example, and only as an example, we're not promoting anything, but If you don't have health care insurance, there clearly are county hospitals, county clinics. They may not be the most attractive places to go, but they are some place to go in order to get health care. There are also now today within pharmacies, medical clinics, things like minute clinics, but clinics all over in major chains. And they're run by nurses, so congratulations to the nurses. They are run by nurses, and you go to them for a specific problem that they can treat. And then clearly there's a pharmacy right in the building for them to be able to write the appropriate prescriptions to give you prescriptions to do it. So there are, if you don't have healthcare insurance, there are alternatives. They still cost something, but they have some alternative to it. And then to go look for some of these less expensive. Nothing here is inexpensive, but you're trying to do cost comparison to see where you can find something that does it. In the future, I expect that there'll be more technology-driven plans who will cut the cost because they will cut out a lot of the middlemen costs and go directly from here's the plan, here's what it offers, and go direct to the consumer.
Right. So just a quick reminder, make sure when you see a nurse or if you know a nurse, right, Craig?
Absolutely.
Right?
Absolutely.
That one was for Carol. I know she's going to watch this. So moving on, we talked about price comparisons, right? We talk about price comparisons strictly with prescription medication.
Yes.
So one of the reasons this topic came up with the brief discussion that I had with the producer M was there was a video about a certain patient, and we're not advocating this. Please do not do this at home. But this patient couldn't afford her medication. So she was able to get her medication at a lower cost from a vet. And, of course, problems ensued. But without going into too much detail about that video, is it possible to get one drug that's actually for humans and be able to get it at a lower cost from a vet?
Yeah. Number one is, this is a terrible idea. It's just horrible. Number one is, drugs for animals are labeled as not for human use. Drugs for humans are labeled for human use.
But it might be in the fine print, so you might.
Thank you. But it's true, there are therapies that you use that are in parallel to what goes on. And it certainly happens with ophthalmics for eyes, and if you're treating a dog or something for medications to treat certain problems with the eyes, it can parallel exactly what you use in humans to treat the same condition. But bottom line is veterinarians don't prescribe for humans. Number two is they have a limited number of medications that they do based on categories of drugs. And they are in general medications that are being used to treat conditions for multiple animals, multiple sizes of animals that do not translate easily to the size of humans. Fundamentally, it's just a horrible, horrible idea. If you're trying to save money, there are some things on the internet, like GoodRx and others. I'm not promoting anything, but they're available on the internet.
We'll put the link up there for you.
We'll put the link so that you can find it, and then you can compare what the price is between different pharmacies. That does not make it affordable. It just identifies that pharmacy to pharmacy to pharmacy that there are differences in cost if you walk in and you pay cash. If you're getting it as part of a health plan, it's an entirely different story because those have discounts.
Right. So you're saying I shouldn't get my antidepressants from a vet?
No.
Right. I was asking for a friend.
Thank you. Yes, of course you were. Yes,
definitely. Yeah. So with the medications, we also want to point out that we're gonna, if you would like to get an OTC formulary, because we do have an OTC formulary that we created in-house, right? One of our student interns who did an amazing job. Good job, Michael. It was an OTC formulary. If you would like it, please feel free to, we'll put the link up there for you to contact us on our ProPharmaConsultants.com website. And you can just fill out the form and ask for it in the little comment section or message section. And we'll send that out to you as soon as we can.
Yeah, let me add something.
Yeah, go ahead.
The issue here is if you don't have healthcare insurance how are you going to afford drugs? The argument has been that as new drugs come out, they're better. The older drugs are not. And so as a result of that, you need to find a way to get the newer drugs. And many of them have good reason to be that way. However, the older drugs still work.
Right.
When you look at the population in general, treating common things like high blood pressure, diabetes, issues with high cholesterol and things like that, there are drugs that are cheaper. Frequently, you can look at the $4 list or the discounted generic list. You can find them at Walmart and Target and Optum and everybody else. And you look at those to see which ones are on their $4 tiers that will then cut your cost of drugs.
Right.
You'll still have to get a prescription for it, but at least the cost of the drug will be reduced. And in probably 80% of the cases, this is a disclaimer, obviously, because if you have multiple comorbid conditions or conditions in addition, it may not be able to work. But bottom line is, most patients can at least get control of their major problems using many of these drugs. They're older, yes. They work, yes. And hopefully side effects will not be a barrier, but if they are, then clearly you have to change for it.
Right.
But more often than not, they are treatable and useful. Separately, you can walk into a pharmacy or in many cases a supermarket or otherwise to get over-the-counter products that don't require a prescription. Now, there are limits to it, and there are things that you do that make sense for you to do it for a few days, but don't make sense for you to do it on an ongoing basis. Yes, one of our interns put together, he did a marvelous job, and I didn't think about it when I gave him that assignment, but this is an opportunity for people to take advantage of it.
Right.
And yes, it's free, and yes, all you have to do is contact us, and we'll be happy to give it to you.
Right, right. And another thing is, you mentioned the low-cost generics, you know, the discount generics, the $4 list, the low-cost formulary, the free OTC formulary we're going to give you. What about PAP programs? We've heard a lot of these. What do they actually mean, and what use could it be for the patient?
It is not for everyone.
Okay.
If someone is below, and it depends on the manufacturer, but below, at or below 134% of the federal poverty level, or 150% of the federal poverty level, and just purely as a rule of thumb, thinking the federal poverty level is about $11,000 a year, then that 10,000 or 11,000 plus 34%, or 11,000 plus 15% plus 50%, etc. Then manufacturers are available. You have to fill out a bunch of paperwork. The doctor has to fill out some paperwork, but it is available, and the manufacturer pays the cost of the drug. They do not include, they have what's known as a means test. They do not include the value of your home or the value of your car, but they include everything else. So in that regard, for people who are poor, there is an opportunity for them to get medications for free from a manufacturer, but once again, it's only for a limited group of people for whom that works.
So they make it really complicated in order for you to get your drug covered.
Well, and they're doing it because the manufacturers get tax advantages when they're developing a drug. So the give and take with the federal government is you got tax advantages, therefore you have to give product that is cheap to individuals who can't afford it. That's the quid pro quo to deal with what goes on. Right.
And just a small little disclaimer, we're going to provide an OTC formulary and where to get these drugs at a cheaper cost, or at least a price comparison. Always consult your doctor before getting them.
Absolutely, absolutely. If you're expecting that you can just go do whatever you want and deal with it, you're making a huge mistake, because there could be problems with it that you need to know about it. In general, the quote $4 lists or discount generic lists that are available are there. You need a prescription from a doctor, but they are cheaper in cost than others. And when you look at the formularies that are available on the web for all of these different groups, CVS, Walgreens, Walmart, Target, whoever, bottom line here is look for the drugs that are tier 1, which is generics.
Right.
Look for those that are tier 2, which is their preferred brand drug, and ignore everything else if you're trying to save money. If those don't work, then yes, you're going to have to deal with the others. And clearly, there are complications and issues. We certainly deal with it. It's part of what we do to deal with those people that are more complicated. But we're trying to give you some options and make sure that those options are available to you to look at. If they work, fine. If they don't work, then you're going to have to deal with some other issues. But just because something is older, because it's generic, doesn't mean it doesn't work. That's really not true. It only means that there's something newer, maybe there's some benefits to it for side effects or otherwise, but the older drugs still work. They've worked for people for years, decades, etc. So there is an opportunity for you, presuming that you don't have any problems with it.
They work and they're typically cheaper. Just to put a button on this, and of course, before everything, if you want to avoid getting medications or having to rely on medications, you can prevent them. In most cases, you can prevent them. Some of these independent risk factors, I mean, we've talked about it for several episodes in regards to diabetes and obesity. Please feel free to go back and watch those. They seem to be reappearing, and it seems like we're repeating ourselves with some of these independent risk factors. If you would you like to go over them again?
Sure. Let me just quickly identify it, and that is the very best doctor is the doctor who sees a problem before it happens.
Okay.
Prevention is the key. It's the key today. It was the key before. There's even some old Chinese comments about the best doctor is the doctor who perceives a problem before it occurs. Weight loss, watching your diet in order to eat healthy foods, avoiding a sedentary lifestyle, meaning not sitting all the time, getting up, getting exercise, and dealing with it at least a half an hour every day, and then issues with regard to stopping smoking are independent risk factors. So even if you had drugs and you got your blood pressure in control, you got your diabetes in control, etc., if you're still obese, that's an independent risk factor that is still going to create the complications of the disease. If you continue to smoke, even though you have control, you're going to get the complications, the cardiovascular complications of smoking, namely stroke, heart attack, etc. If you lead a sedentary lifestyle, it's an independent risk factor. Even though you have control of all of these things, you still are going to address these problems. We've published it, by the way. There's articles that we've published. They're up on our webpage. I'll ask Em to attach them if you're interested, where we've addressed it, but they're independent risk factors. So you can't just say, well, I've got my blood pressure in control, I have my diabetes in control, I'm fine, I can eat whatever I want and the rest. No, no, no. You've got to pay attention to those issues.
Thank you very much, and that's all we have for you today. Thank you for watching this edition of Professor Speaks. Next week, I will be out of town. I'll be traveling, so there won't be a new video next week, but you can catch up on previous episodes. I just want to remind you to go to ProPharmaConsultants.com, subscribe, hit the little bell for notifications, and like and comment. And if you don't like, apes are going to take over the whole world.